Hey, everybody. Hope you enjoy this episode of Gross Anatomy. Lauren dissects season 2 of The Pitt. Check it out. Are we live, Lauren Taylor?
We are live, Dr. Cohen.
We're live at Gross Anatomy Podcast, where we explore the sights, smells, and sounds of medicine, how it relates to movies, TV, books, pop culture, podcasts, and the world around us. And I am still Dr. Jason Cohen.
And I'm still Lauren Taylor. And what almost 10 million people did was watch the finale of The Pitt.
Wow. I did not do it. I have to confess.
No, I know. You find it stressful, which I get. You're not the only medical professional that finds it stressful.
The finale of The Pitt, eh?
Huge hit show. I think the second season was just as good as the first. If you ever want to check out the full thing. If not, I've been writing up some storylines, some patient ailments that came in that I kind of wanted to pick your brain about.
Let's do it. Let's do some spoilers. Let's do some spoiling.
Okay, well, we only talked about like the first episode. We have
first episode or first 2 episodes, I thought.
We did. Well, we were only supposed to do the first episode, and then you ruined the second episode.
Nice. That's me. I'm a ruiner. I admit it.
No, not really. Actually, you saved me from
the maggots. The maggots.
Yeah. So I need to look at the floor. So actually, you helped me out.
See, there I go.
And that was in the second episode. So after that, there's a cyber attack system outage. You didn't see any of that, did you?
No cyber.
So in the Pitt, a different hospital was like held hostage. They had a cyber attack. They wanted all this money from them to get up and running again. So then they shut down the Pitt just to be safe. So they wouldn't be hostages like this other hospital. Anyway, so then they went to paper analog system. And I was wondering, did you start that way with paper?
I definitely started in paper back in the day. We had paper charts, and I was there for the beginning of the electronic medical record. And interestingly enough, the early electronic medical records, while they weren't necessarily hospital friendly in terms of the billing and the coding, they were way more doctor user friendly, which is really interesting. The early electronic medical records, both on the East Coast and here that I used, were both way more doctor friendly. They were just more intuitive to use, easier to use, simpler, less work, less headache, less in terms of ordering tests and getting labs and getting results and logging in. It was way simpler, way more doctor friendly to use for data collecting, for looking at things. Whereas the current electronic medical record is so much less doctor friendly, but it's a crazy thing that people don't realize. Yes, patients maybe like it because they have electronic medical record, which I think they would have on those older systems too. But the truth is, these electronic medical records, they're to benefit the hospitals, the coders, the billers, the insurance companies, medical legal, for all of that stuff. And it's crazy. But that's the reality of the world that we live in, that's how and why these systems were built, really to optimize capturing patient data, patient information, patient billing information, coding information. It really is interesting when you see not a lot of doctors saw the different electronic medical records evolve. And it's interesting.
No, I was wondering, you just answered my question, because I was wondering if there was something that you missed about that. And I get that, because today, I got 5 emails that I had to fill out these forms before my appointment. I'm like, what do I have to fill out? And so I finally did it. And it was basically, they were trying to market to me. They were trying to see if I qualify for something else they could sell me. And I was so annoyed. I was like, of course. They made me think it was so important.
That's a whole other interesting thing. Yeah, that I didn't even think of. And I think the whole, the amount of logging in, if I'm in my computer on the medical record and then I like to bring my laptop in when I see patients, new patients, so I could chart while I'm talking to them and see their record. it doesn't let me stay logged into both computers. It automatically logs me out of my main computer, and I have to re-log in. And then when I come back to go back on my main computer, I have to re-log in. But it's not just re-log in. I have to two-factor authenticate with a
Right.
special password and code. And I want to start a class action lawsuit. I want my time back
Yeah.
that
I
these
didn't
computer systems have stolen from me.
I didn't think about that because you used to be able to just be like, show them, here's a chart. Here's like, yeah, you don't
Yeah.
have that.
And not only that, if you don't have your cell phone, you can't log
Mhm.
in because you need that two-factor authentication. And you can't even go into your phone without putting a password in. So it's like so many layers. And I think, I don't know, I almost think let people have my patient information. I think
Mhm.
a lot of all this HIPAA and patient confidentiality and these healthcare systems, I think a lot of it is just dealing with the what ifs. And I think a lot of these security systems are probably built by the hackers. There's probably some, let's deliberately hack so that they have to buy our security system. There
Maybe.
must.
I mean, they never went into it in the pit. I think they paid off the first hospital, the cyber attack, and then
That's
they
crazy.
finally, like toward the end, like Dana called in another nurse that had like charge nurse that had only used like paper analog system and got the hospital straightened out. And then they came back up and running. I
Paper was great. And when I was in Africa, all we had was paper. You scribble 3 lines and that would be it. It was the greatest thing.
And then you get to see more patients that way, I'm sure.
Way more.
Because at the end of the season, like it showed, the younger doctors were just so exhausted, like giving all this information into a reporter and like having to check it. It just seemed more exhausting than it used to be, which is interesting with all this
Yeah.
technology.
Yeah, it's definitely a reason for burnout, for docs. And in fact, one of the talks at this endocrine surgery meeting was about AI for taking notes. There's now listening AI software that
Hmm.
listens to the patient doctor interaction and turns it into a note, so that you don't have to be there typing, and it is smart enough to know what to put in the note from the conversation. But then the doctor has to, go back, look at it, and edit it and fix it. But
Right.
um, what this doctor who gave this talk showed that it didn't necessarily, it only like saved the doctor 16 minutes a day. But despite it only saving 16 minutes a day, it gave the doctor a lot more satisfaction and less burnout, which was an interesting statistic. Um, I don't know how much I believe that. I think it's,
Yeah,
the AI, medical record companies kind of proving
obviously.
that, but who
Yeah.
knows?
Yeah, that's kind of like the pit kind of showed a little bit of that too.
I
Um,
remember just one other topic along
yeah.
the other side. I remember when the electronic medical record rolled out at the hospital where I'm at. I remember there were doctors who were like, older in age, who probably could have practiced for another 5 or 10 years, but because they didn't want to have to learn this electronic medical record, they took early retirement and were like, I'm done, which was really an interesting phenomenon.
So that's going to happen with AI, is what you're saying,
No,
probably.
no,
No?
because I think most people are embracing AI at this point. And I think we're
Mhm.
all, any doctor who's practicing, no matter the age, is kind of already dealing with this.
Yeah, true. It seems like it anyway. Every profession is dealing with it in some way. All right. So then there's another patient that comes in with sepsis, but it's basically just what they think is a foot infection that can be treated with antibiotics. But you're going to have to say the real name of this, but it's flesh-eating
necrotizing
bacteria.
necrotizing fasciitis. Is that what it is?
Mhm.
Yeah.
Yeah. So then she goes into severe septic shock because Dr. Langdon tells her to come back. And I don't think he did anything wrong because I think that initially was what, like, he was like, if it spreads, come back. But it was still too late. And they ended up having to do an above the knee amputation, which is crazy.
Yeah,
So
that
my
really
question,
happens.
yeah. So I was going to ask you, like, what else could a patient do? You're in the hospital, you take the antibiotics. Like, what can be done?
It happens, and it happens fast. And if not treated and not identified and not dealt with, both with certain times big gun antibiotics, like big broad antibiotics that wipe out stuff, and often surgical treatment to kind of open everything up and get out the evil, it could progress, and it could progress fast with even potential loss of life. I mean, loss of limb is one thing, horrible, but even loss of life.
Well, I think that's why, I mean, they kind of considered it a win. They saved her life. They opened her up, like they opened her leg, even though they weren't supposed to. They were supposed to wait for, I guess, to take her up to the OR, and they were like, there's no time or whatever. So
Yeah,
I don't
and
know.
it could really progress that fast. And I do think sometimes with early appropriate big antibiotics, oftentimes, if you're really aggressive about that, this is just my own theory that you could sometimes uh, get fight it better and maybe prevent it from happening. The reluctance often is whether or not you're making that diagnosis. Let's start with more targeted antibiotics. I think that could sometimes happen. So if I'm ever called on a case where I suspect it at all, I don't wait for an infectious disease doctor or the medical doctor. I will automatically just put them on, huge antibiotics, sometimes more multiple antibiotics to try to bombard that. And and luckily, we've been successful. But one of my earliest cases as a resident was a woman who had had flesh-eating bacteria, necrotizing fasciitis, and it could often start like in the groin area. There's something called Fournier's gangrene, which is specifically related to like the groin genital area. Like it could progress and like eat a patient's scrotum and testicles and penis. And so we had this one woman that started in her groin, and we had to fillet open her entire groin, her labia, and everything was wide open. And back in the day, we used to have to do multiple dressing changes every day after we treated her. And it would, she was this wonderful woman, she would sing. Remember that song? I don't even know how it goes. That song that goes, doo doo, hot, 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 da 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 da, hot, hot, hot. Remember that song? So she would sing that with us every time we would do her dressing changes. That's how she would deal with the pain, and we would kind of sing it with her because we had to do these massive dressing changes, and she would go hot, hot, hot. And I just remember, and she survived, and ultimately made it out of there. But I've seen
But
crazy
so I
stuff.
know we've talked about this before, but as a kind of hypochondriac doing this show, that why would that woman, they never went into like why that woman got it in the show, or like, do you know why the woman got it that was like one of your first patients that you saw with it?
BFL, bad fargan luck. I've seen it happen in rock stars, in
Right.
attorneys. I've seen it happen in all sorts of people, and I saw it happen in a attorney who went for a pedicure. I've seen it happen in someone who just had this what they thought was a spider bite. I've seen it happen in someone who just had a pimple that they kind of thought was going to get better. It's just it gets infected, and they get super infected, and then who
Hmm.
knows?
All right. I know. I wish there was an answer. I knew there wasn't going to be, but I thought I'd ask you again anyway.
Yeah, yeah.
All right. It's bad luck. So hopefully you get the
But the
right
main thing
antibiotic.
is when in doubt, get it checked out. I say that all the time about all different things. If in doubt, get it checked out. Don't ignore it. Don't sit on it. And I'm a big fan of soap, water, and good old air. Don't start trying to treat it yourself. Wash it, keep it clean and dry, but go get it checked out. Don't start putting creams and salves or try to heat it or pop it, or don't do any of that stuff. Soap, water, air, go get seen.
Okay. No, that's good advice.
Yeah.
All right. Then another storyline, they had like a deaf patient, and this poor woman was waiting for 4 episodes. And I was like, oh God, is she
Four
gonna die?
episodes?
Yeah, like you keep seeing her in the waiting room, or like the 3rd episode, someone finally comes to get her and they say, oh, I'm sorry, just now seeing that you require an ASL person. So then the 4th episode, they finally get her someone to like, say that she's been having the stomach pain and all this stuff. And I think I'm assuming she's gonna die because they waited so long. But then it just kind of like disappears. Nothing happens. I think the point is to just show you that like there are deaf patients and they need help, and like kind of how doctors, once she finally got the ASL interpreter, like the doctor kind of just like looked at the interpreter and didn't even like treat her as a really like a person, so it was
Wow.
interesting to see.
Yeah. Actually, that's a weird thing that often happens, even with myself. Like when you have a patient and then a translator's in the room, or sometimes it's a language that we don't necessarily have a translator for, and we have the phone kind of service, a phone person that there's some kind of line you call, some kind of service that you call with a translator on the phone. And even though you have a patient sitting across from you, you find that you're
Looking
facing
at
the
the screen.
phone or you're
Hmm.
facing the translator. And I always have to remember to look at the patient. And I'm always saying, why am I looking at the translator? Why am I
Right.
looking at the phone? Like the patient and I are looking at the phone.
Well,
It's like the weirdest, funny, weird, strange scenario that the patient and I are watching the phone and there's no one there's no one there. It's a phone.
yeah, but at least you're aware of it. At least you know to like look at the patient. So,
Yeah.
but
Yeah.
yeah, something you gotta get used to, I guess. And then there was, I don't have a clip of this, but I wish I did. It kind of went multiple episode storylines. Anyways, there's this big family reunion, and they kind of seem like Kentucky people, even though it's like Pennsylvania. I guess they're from, the country. I think they're in like race car gear or whatever. They're having a family reunion, and one guy comes in. I think he has high blood pressure or something. And at the family reunion, they have this habit of just putting all their pills on a table, and then they just take some. They just take each other's pills, and so they're trying to figure out what's happening with this old guy, and they were like, go back and figure out what this pill is. And so they FaceTime the doctors at the hospital, and apparently they found out he took propranolol,
Propanolol.
propranolol, a medication which drastically lowered his blood pressure. So they were like, they couldn't figure out what was happening to him. So I guess it was
Fun,
that.
Yeah, that's a crazy thing. But fun fact about propanolol, also called Inderal, it's called a beta blocker. And it's actually a medicine that's commonly used it can be used for headaches, but it's also interestingly used for public speaking. People take propanolol who get nervous, even a little bit of nervousness or anxiety speaking, because what it does is, as long as you don't have any underlying medical condition, it'll slow your heart rate down. It eliminates like the dry mouth, the elevated heart rate or tachycardia, and you may still be nervous or anxious, but part of what keeps feeding in and triggering your nervousness and anxiety is you start noticing your heart is racing and your mouth is drying and you're getting, so it stops that. People who give a talk, or something like that, or a speech, taking Inderal or propanolol.
It was alarming to the doctors in the show because it was so low.
Well,
But I don't.
if you have underlying medical issues or take too much of it, it could, cause a significant slowing of your heart rate and dropping your
Mhm.
blood pressure. So you have to make sure you're not dehydrated, you don't have other medical issues. So definitely, don't just take it.
Right, right. Another thing that I saw on the show was low potassium, hypokalemic periodic paralysis. Ever heard of that? This guy comes in and yeah, he's basically paralyzed, and they realize it's like his potassium is so low that I guess this causes the potassium in his bodyguard was being transferred to cells and failing to fuel his body as needed, which I never heard of. I mean, I've heard of low potassium, but I didn't know. I've never heard of that.
Yeah. I know you could get muscle aches and cramps and stuff like that from low potassium potentially, but I don't remember it. I may have learned it, but I don't remember low potassium paralysis. I do know you get cramping and things like that, and even more severe things from low potassium, or fatality from overly high potassium. Actually, it's actually a way to kill someone if you want to give them a potassium injection, a rapid potassium injection. It's like a known way you could off somebody, if you want to.
Explain. I don't feel like we talk about high potassium. Like,
Yeah,
so.
high potassium could be fatal given rapidly and too much, because it causes, our cells are we're basically like batteries, positive minus charge kind of things, and potassium's this positive charge thing, and it could just screw up your whole electric system. And we need potassium for our heart. And we need it perfectly balanced. So if it could just screw up all your electricity of your heart if you get too much
Mhm.
potassium. And
Okay.
if your potassium's too low, I mean, either way, you could have
Right.
irregular heart things if you're not normal. We definitely need potassium for our heart muscle.
So if someone's low potassium, I mean, like, do you just have to look at their numbers and be like, you can just eat more bananas, or you have to be on pills, like that type
Yeah,
of thing?
it depends. Well, there are certain, medical conditions why people could have low potassium. They could be on certain medicines that could cause them to pee out too much potassium. There's certain diuretics, that patients are on for blood pressure or heart issues cause potassium wasting, and often those patients actually have to be on potassium supplements if you're on those pills that make you pee out water. You pee out not just water, you pee out your potassium. So
Mm.
those patients have to be on potassium. But then there are medical conditions or tumors even of the adrenal glands that could potentially cause problems with our potassium levels.
Okay, interesting. I guess I mean I get my yearly checkup. I guess that's when they check it. I mean, I'm
If you're healthy, you really shouldn't have a problem with potassium. But
okay.
I mean, if you're wandering the desert and not drinking it or anything, or been vomiting up a ton because a lot of our gastric fluid is acidic and it causes shifts in our potassium. So, like, severe vomiting, severe GI illnesses, that's one of the reasons why patients potentially, get really sick is their electrolytes become all
Mhm.
abnormal.
Okay, that makes sense. One other quick thing was there was some male EMS workers that come in and they don't. I guess a common thing, or they make it seem like in the show it's a common thing, like with men, like healthcare workers or that work in the ambulance, are like scared her to like touch women or whatever. So they didn't. This woman had large breasts, so they like didn't put her the interior leads like
Right.
where they
The
needed to be.
electrodes, the EKG leads. Yeah.
Yeah, so they weren't getting the right thing, and then she went to like cardiac arrest, and Dr. Robbie like pulls them out, like calls them out in front of everybody, and is like he asked for all the females' attention in front of these male EMS workers. He's like, would you guys choose death with modesty or life with brief nudity? And they're all like, obviously life. And the male workers are like, why do you have to call us out like that in front of everyone? He's like, this is a good lesson. Like he's very harsh, but it's, I guess, something that actually happens. I'm assuming they got this storyline from somewhere too, like they don't want to like make her feel awkward, but they don't get the leads in the right place.
Yeah. You see that with celebrities too. You hear the story where, the celebrity didn't get the rectal exam or something, and you missed a low rectal cancer, because they didn't want to, make the celeb uncomfortable, or because they were uncomfortable, or they're trying to give extra care, and so
That's
um,
interesting.
you got to treat people like people, so, and theoretically everybody's the same.
Right, and you're doctors and you've seen it all before, so
Yeah, pretty much.
shouldn't shouldn't be a big deal. But yeah, so I guess they put that in for a reason.
How does it end? Give me a spoiler alert.
Spoiler
Spoiler alert. Lauren's
alert.
telling us how it ends. How does it end?
So I think Noah Wiley just got his second Emmy and all the other awards. I think it's another sweep for him. It's so they showed the first season's like he's has a
Burnt
breakdown,
out.
whatever.
Yeah.
But this he still hasn't. He's about to go on his sabbatical, but really no like people around him start thinking like, is he coming back from the sabbatical? Is he like going to drive off a cliff? Because it all comes together with him driving. He rode a motorcycle without a helmet. Like
Right. I
that
saw.
was
Right.
uh he doesn't care. Like
He's a
so
death
it's
wish.
yeah. So it's basically like people like that, the Nightcrawler leader, Dr. Abbott, like, trying to talk to him and like people trying to talk to him. And you just really feel like what he's going through. And he gives a really good monologue at the end. And I mean, you assume he's going to be obviously he's going to be in it next season. So he's going to be okay. But it's,
So it ends with us thinking that he's going off the deep end. Is that how it ends? Or it ends
well,
like
it ends
we
with
think
like being
he's
like, is he actually going to take, like, he needs a break, but like, is he going to be able to come, like, is he coming back? Like, is he, he doesn't know how to take a break. That's the problem. He
got it.
doesn't know.
And do they
It's,
show the surgeon character anymore? The female surgeon character much or not really?
they do not really like, you're right. I don't know the actress's name, but she's good. Like, she could have her own show.
Yeah.
They don't show the surgeons enough.
Hmm.
from the OR.
Yeah.
So that is the Pitt. Dr. Robin's still losing it a bit.
He's still
But
losing the Pitt. Got it.
yeah,
Got it.
but it's a very good show, but stressful.
Cool. Cool. I guess, maybe I'll watch it. I don't know. I
You
don't.
don't have to. I went over some highlights for you in our
There you go.
audience. In case you don't
Yeah.
want to watch it.
There you go. You know what I'm doing? I started reading the book Hamnet.
I was going to ask you. So we end with what we're watching or reading.
Yeah.
And nuts. Okay.
Yeah. I was on a plane and they didn't have TV thing, at all. So I bought a book at the the gift shop and they recently made the movie Hamnet. So I'm like, let me read. Did you see the movie?
No, but as I just had some friends over when they were talking about it, and they just made it seem like really great. And Dr. Gordon was on saying
Right.
like it was
Exactly.
great, so I got to watch it. But then they were saying it was from a book, so
Yeah. So I'm reading. So I decided to read the book. I'm halfway through. I'm really enjoying the book.
okay, that's
Yeah.
great. I mean, it sounds cool. So I gotta just watch this movie.
And in the book, one of the people get bubonic plague. I'm up to the part where people are getting bubonic plague, which is kind of, one of those crazy infectious parasitic illnesses back in the olden days where people died a horrible death. So it's interesting to see and read about that.
Okay. Yeah, you'll have to tell us more when you're finished with it.
All right, Lauren Taylor. So thanks for listening, everybody, to Gross Anatomy. Hope you enjoyed Lauren dissecting out the finale of the Pitt.
Season 2. That's it. All right.
Season
Thanks,
2.
everyone.
Thanks, everyone.
That's it for this week. Thanks for listening to Gross Anatomy, and be sure to subscribe to our podcast so you can check out more episodes on the evolving sights, smells, and sounds of medicine. Gross Anatomy is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition.